Like I said, pain is mysterious. There are so many factors. And it's also really, it can be difficult sometimes to know what helped. Sometimes time helps, sometimes changing activities helps. Not doing anything over a long period of time does not usually help unless it was some sort of traumatic incident. If it's just mysterious pain that keeps coming back, usually something's going to need to shift. If you're someone who has dealt with recurring pain, then you actually know a lot. It can feel very overwhelming, and it is, but you have had the experience of both the initial irritation combined with flare-ups, and you have accumulated information about what feels good, what doesn't feel good during that time, and all of that can be very, very helpful. So don't give up hope. Don't give up hope is my pep talk. I do like to hear about previous activities or injuries that led up to this, because it can sometimes be useful. You're going to need to address the pain, but sometimes if you can just go back one step and see, that was just a few months before this other thing happened, it might be useful as you think of your body as think of everything being very connected, and that might be useful in how you explore movement as a tool to feel better. It is totally normal if you feel very disheartened by having recurring pain. That is normal. But it doesn't mean to give up hope. It does not mean that. Are there little things that you're not thinking of that could make you feel a lot better? I can think of two really specific examples. One person I worked with, she was driving in high heels, and when she stopped driving in high heels, she had less back pain. So it didn't cure the main issue, but it did give her a lot of pain relief. So another example was I worked with someone who had I didn't know this, but at home, she had a very strangely shaped chair, and very out of the ordinary, something I could have never imagined. And then one day she realized that actually that was really irritating her back. And so she stopped with that chair. Now, if you can't sit in a regular chair, that's different. That's very different. But this was not that. Being able to stay somewhat calm when stressed about the pain may be helpful. It's not the answer to the injury, right? But then the level of tension in the body. I mean, that's another factor, is when we have pain, then we get so tense because the body is trying to protect the area that's in pain. And then there's just so much stiffness everywhere, right? The bracing of trying not to move. All right, it was supposed to be pain a pep talk. Don't give up. Pain a pep talk. Don't give up. Yes, it can be very, very difficult and very, very disheartening. And you can only do the best you can do with the tools you have. If you find that some of your pain is movement-based, I would say don't give up hope, because you can learn new things. You can do new things.